So I just met Tina, and she's 60 years old, and this is the first time that she has ever been to a doctor.
All they want is information and education about how they can make their children or themselves better.
The goal of Learn to Live is to provide basic preventative healthcare, health education, and sustainable clean water systems to remote communities in the world that need them. In 2013, we returned to North Sulawesi, Indonesia to work in the villages we started in last year and to expand into new ones.
My name's Adam.
Katie Brown.
Jack Timon.
Carrie Fisher.
Michelle.
Lee Hill.
Claire Faya.
Rocky Mollair, I'm one of the doctors. Student residents.
Nutritionist. Translator.
I'm an RN.
A registered nurse.
Pediatrician from New Orleans.
Tondano.
Melbourne, Australia.
Manado.
Cut off Louisiana.
Victoria in Australia.
This is day one of the supper clinics.
Our clinics are running so smoothly. I have an amazing team with me. It's amazing to see patients who came to our Learn to Live clinics last year and are back here again. It really shows that we're building a relationship with the community.
Ya, sejak Learn to Live datang tahun lalu ada perubahan itu tentang kesehatan masyarakat.
This is our third day in Rio.
Maxie was here last year with basilar squamous cell carcinoma just above his ear. It's worse now and it's bleeding. He was told to go to the hospital last year. It's difficult for him to get there. He would go if he could get help with transport.
He could come down with us and we could get him there by Monday.
Bringen is a village that's very isolated on top of a mountain. I think the main problem here is just a lack of access.
Sandro came in with his grandma. When I looked in his mouth, the dental decay is huge. We've spoken to grandma about the importance now of oral hygiene. It's rare that I'm seeing a child without any dental decay. Certainly his mouth is typical of the other two villages that we've already been to.
This is the first day of the Bunaken clinic.
We've just had a young boy come into the clinic. He's been on a fishing boat this morning and has jumped off into the water and onto a piece of glass.
Had an extremely deep laceration on the underside of his foot.
This is a really high trauma accident.
We were able to stabilize him, stop the bleeding.
And what Learn to Live's going to do is we're going to pay for the transport. I've connected with one of the local doctors who'll send an ambulance to meet us at the pier in Manado, and then he'll go and get treated at one of the trauma hospitals in Manado.
Without our help today, this little boy would have been in big trouble, I think.
Saladen is a very small island off of the coast of Manado. It's a very small population, it's very isolated. The resources are very limited.
It's the first clinic that we have run here. They have no access to healthcare and we're seeing some really sick people at the moment. The same issues that we've seen in other clinics, except they're exacerbated here by the location.
For me, water is the most important. Water is very expensive here. We have no fresh water, we have to drink water from Manado. We cannot drink water like this.
This year in Supper, we built a rainwater harvesting system with biofiltration to supply sustainable water to the community, especially the school.
We've designed a curriculum as part of the program, which Carol, one of our members, has been teaching the kids about conservation, preservation, sustainable water uses, the safety of using rainwater itself.
Masyarakat Sapa Barat menerima dengan senang hati dan gembira atas kedatangan dokter-dokter atau Learn to Live memeriksakan kesehatan dan membuat air bersih.
Learn to Live 2013 is coming to an end. We've treated hundreds of patients this year and I really feel as though that we've made a difference. The changes that we've made in the program I feel have really made an impact on the people that we're seeing.
2013 was an amazing year for Learn to Live. We helped more villages, more people, with more in-depth healthcare than ever before. We provided clean water for our community and armed them with the knowledge of how to do it themselves. In 2014, we're expanding our mission further. We've run our first project in Laos and will return to Indonesia to reach even more communities. Learn to Live isn't just about helping people, it's about teaching people how to help themselves and teaching ourselves how to be better at helping people. To find out more about our work and how you can help, Visit us at www.learntoliveglobal.org.